It's a new study that found that strokes are on the decline for men, but not for women. And Dr. Ashton, you're here to help us understand all this. Good morning to you. And even with the rates on decline for men, the strokes that's going down for men, but it really overall hasn't really changed. What does this study tell us?
So this was a huge study. It appeared in the journal Neurology, and it looked at over 1 million people, 1.3 million people over a 15-year period, just to look at the rates. So taking the pulse of what's going on, what are the numbers, and it found that for men, good news, the rates of stroke are going down. For women, they stayed the same. So again, we have to always track these major diseases and health outcomes because that's obviously very clinically relevant.
But the natural question, why are they going down for men and women to stay the same?
Well, look, I mean, it's important to realize that as a society, we're not getting healthier, unfortunately, although we are living slightly longer. So for both men and women, the things that increase the rates of stroke, high blood pressure, high cholesterol, diabetes, obesity, we see that again and again. That's going up for everyone. For women, they don't really understand what's really causing this change in stroke rates. So again, there are some possible theories here. Causes for women, heart disease, which we know the #1 killer of men and women. You know, the same thing predisposes you for a risk of stroke. Less aggressive treatment possibly in women, or women who may be less compliant with their medications, like blood pressure lowering medications. And then hormone therapy, we know there is a slight association between increased risk of stroke or clotting events in women who take hormones. So again, a lot of questions, not a lot of conclusive answers at this point.
And what exactly could women do to cut their risk?
Well, I mean, you have to ask, first of all, what causes a stroke? And remember, there's 2 different kinds of strokes. There's a bleeding kind of stroke, but the most common cause is something called an ischemic stroke, where the blood supply gets kind of cut off. So when you talk about lowering that risk, the same thing that's good for the heart is good for the brain. Know your numbers, your blood pressure, your cholesterol, exercise. If you smoke, stop, and know your family history. So again, prevention is very important. The good news is 80% of strokes are preventable.
Oh, that's great news.
Yeah.
And thank you.
I'd like to end on a good note.
Got to end on a good note, and thank you for giving us that information. And George, I'm going to go over to you.
A lot of good advice right there. We're going to move on now to some financial